Imagine.
We appreciate your company this fund. If you just tuned in, this is Y254 News Highlights. Here tonight we are talking about the fight against malaria, and tonight we are asking, is Kenya winning the fight against malaria? Talk to us through our SMS line 22162, starting with the word Y News. 22162 is the SMS line to use. Remember to start with the word Y News. We now move to our conversation with my guest here. As I had mentioned earlier, Delphine Kerubo. She is a clinical officer. Sorry. Yes. Kerubo, malaria has been a killer disease. This has been happening year in, year out, and over time we have been losing people because of malaria. Yes. And now the question I want to ask tonight is, where are we at a nation so far? Where are we? Just the other day we were marking Malaria Day on 25th of April. Yeah, so as a nation, where are we?
To be candid with you, Hillary, we've come from far. There's a time malaria was killing young kids, pregnant women, including even adults. But so far, we've come from far. That is what I can say.
We've come from far.
Because we've put in measures, a lot of measures, including community health volunteers treating simple malaria. We've included nets, like to be in every household to have long-lasting insecticide-treated nets. And also we have chemoprophylaxis, where people can actually take drugs when they're going to malaria endemic regions. Yes, and there's a breakthrough of this vaccination that is being rolled out as a pilot. So we are hoping that it works, and yeah. We've come from far. Yeah,
just before we move on to the vaccination that will be coming much later. Yes. Looking back, 2016 we lost a lot of people, according to a few statistics. Yes. And now, what has the government been doing so far? What are some of the challenges that you have been experiencing in the medical field, working together with the government?
So way back, we were having a lot of misuse of drugs. We were having a lot of people not knowing. The awareness was not clear on what to do when there's malaria outbreak. So we had a lot of capacity building. I remember we had a lot of, short courses for medical staff. We had a lot of engagement with the community, even including community health volunteers, to work on how to prevent malaria. And we had to come up with strategies on how to prevent malaria from the household level to actually to the hospital level. Now, from the household level, let's just see, how does malaria spread? Let's just talk about how does malaria spread. So malaria is a killer disease that is transmitted by a mosquito. But in the mosquito, the parasite stays in the mosquito, where when the mosquito bites you, the parasite comes into your body. That is how mosquito is spread. So how can we now tackle this malaria? Because it is a parasite, remember? Yes. And the mosquito is the one transmitting. Most of the time, mosquito, they breed on water. Yeah, water surface. And actually, when you look at the malaria prevalence in Kenya, it's mostly on the western region and the coastal region because of the high temperatures and also the availability of water. Yes. Yeah. So how can we now strategize and come up to prevent, to cut this transmission of malaria? Right? So we came out with strategies including sleeping under a long-lasting insecticide-treated net, and in your household, just in your household, you can clear bushes where this water can actually invest. Yeah, the empty containers, the plastics, thank God they were banned. They were collecting water, and the mosquito are breeding, definitely growing in number, and thus most of the time the malaria outbreaks were in high. So that is one of the strategies. We had to go back to the community, talk to households that, you know what, we can manage this. So we customized it according to the counties. Like in coast is different, and in western region it is different. Yeah.
Now, you've just spoken of using pesticides and nets.
Yes.
Now, I'm imagining every condition, or if it's a parasite, you're trying to curb it through pesticides. At some point, they will become resistant. How are you working towards this resistance from the mosquitoes?
And I can tell you for free, we've had a lot of resistance. There's a time we were taking malaria queen. There's a time we were taking Amadaya queen to treat malaria. But these parasites actually, they became resistant. That is why we are telling everyone, do not go to any pharmacy and just ask for malaria drugs. No, be confirmed. go to the hospital, go to the nearest community health volunteer near you. They have tests. They have rapid diagnostic tests. When you go to the hospital, you'll be done for microscopy. So that is why we are telling people, do not go to the chemist and just ask for the malaria drugs. No. Be confirmed, because there's so many diseases that can look like malaria. Because one of the symptoms that malaria starts with is fever.
Yes.
Yeah. So there are so many diseases that can start with fever. So we are telling people, let us confirm malaria, let us treat it and diagnose it, yes, and prevent.
Now, speaking of treatment, the provision of drugs, everything that is needed, I want to hear clearly, what is the government really doing about this? Because the last time I checked, there was this one kind of a drug that was said it's more effective than others. Are there others that have been improved or brought or innovated? Like, do we have other drugs that will help us in curb malaria?
Yeah, so in medicine, yeah, there's always a first line that can treat like normal diseases, and then there's second one, which is at least improved and more, you know, stronger than the first line. So lumefantrine is the first line treatment for malaria. When we go to second line, we have artemether. It's an injection, right? So we need to stick to the first line first before we move to the second line. Yes. And prompt for us to reduce resistance. That is why we are saying confirm first malaria before taking the drugs.
Taking the drugs.
Yes.
Now, I want to work within Kenya. Now, the World Health Organization works globally, and I'm sure it takes part even in our country. Now, how is our government, how is our country working with WHO to ensure that we have eradicated malaria for good?
Okay. So last year, the WHO recognizes Kenya as one of the world hit malaria regions. And we are at least 3 countries, Ghana, Malawi, and Kenya. So we were given permission to pilot one of the vaccines called Mosquito, done by GSK. So we're actually lucky because it can actually prevent 40% of the prevalence of malaria. So it's a pilot. Kids will be chosen. A few kids will be chosen, and it will be given in 4 phases. From 5 months to 18 months, they'll be given. In that, the first 3 doses are given after every month, and then the 4th dose will be given at 18 month. Yes.
Now,
so
before I move on to what the WHO will be bringing the vaccine, I want to read a comment here from one of our audience, replying to the question whether Kenya is winning the battle against malaria, and he said, at Betty into the DJ, he says yes and no, and for his reasons are: yes, the government is putting more efforts to eradicate malaria, and no, not all persons are aware that malaria is the leading disease to most deaths. Now, what's your comments on this? Because there's some truth.
Yeah, some truth kidogo.
We've been having adverts in radios and in TV, lala ndani ya neti iliyotibiwa, these things, clear bushes, and most of us ignore.
Okay, you see, when it comes to net usage, people have different opinion on how to use the nets. For example, someone can just say, you know what, I just want my face to be covered with a net. But that is not the case. We are advising people that whenever you're using this long-lasting treated net, it's supposed to be tucked in very well, because we are preventing the mosquito to enter in and bite you and actually give you the malaria, transmit the malaria. Yeah. So let them tuck in very well in the corners of the bed, and ensure that they always put nets after every night as they are going to sleep.
Yeah.
Even during the day.
Yes.
Yes. Because we tend to say, you know, mosquitoes, they bite at night, so during the day I'm safe. No.
You're safe.
Yes.
So you're never safe.
You are never safe, yes.
All right. Now, the vaccine, its efficiency, how do you think this vaccine will be effective? And how many people do you think will go for it? Because when it comes to vaccine, people have this paranoia that vaccine, no, you don't know, maybe they're testing on other things, and many stories will come, many theories will come with it. So how prepared are you in the medical practitioners? How prepared are you to speak out to these people, to the masses that is, and what are the strategies that you've laid out in distribution of these vaccines?
I can tell you for free that vaccine, they came as a breakthrough in the medical sector, right? So most of the diseases, including diarrhea cases, have been prevented by just a vaccine. We had a lot of pneumonia cases long time ago. So many kids were dying because of pneumonia. But nowadays, the number reduced because of what? The pneumococcal vaccination. So we are telling Kenyans, I'm telling everyone that when this vaccine, after the pilot, and the success rate is above 90, let us embrace it. Let us use it, because so many kids, so many pregnant women, so many of our husbands and brothers have died because of malaria. And if we can prevent it by a use of a vaccine, why not? Why can't we use a vaccine? Yes.
And most of the cases now, speaking to someone in the rurals, we understand most of the tests are done to a mice and then to be tested on human beings. Now, this being a pilot, which are some of the areas that you're targeting? Is it the endemic areas like Western and Nyanza and coastal regions? Are these the areas that you're targeting? How about someone who is in Nairobi, who will be traveling to those places and coming back to Nairobi, and then they realize they're sick?
So we need to understand that malaria endemic, we have two regions. We have non-malaria endemic regions and malaria endemic regions. The vaccine definitely will be tested in malaria endemic regions where the vulnerability of these people is high. Because you cannot test someone in Nyeri or someone in Nairobi where the vulnerability is low. So the first priority will be people from Western and the coastal regions, right? And then we want to tell even Nairobians that malaria can come from Busia and actually get you in Nairobi. So let's stick to sleeping under a treated insecticide net, clear bushes around us. Let's wear long clothes during the evening hours. Yes, let's prevent this malaria. Speaking
of clearing bushes and these water puddles, it has been pouring a lot.
Yes.
And very soon the rains will cut. And we will be having these puddles everywhere around our homes, our places of works, because we can see them already, and the rivers have flooded. So these are some of the areas that will be expecting some of the things to be happening. So already, have you laid out a campaign, or you just waiting? Will it be proactive, or what have you done so far?
So mostly during floods, the major disease that we focus on is cholera, right? But yes, malaria is one of them, but it comes maybe number 3, number 4. But cholera is usually number 1. But we are urging Kenyans that no matter where you are, the rains are here, and mosquitoes love water. They breed on water. Kindly let us are there to sleeping under a treated mosquito net. Let us are there to, clearing our bushes. Collect all these empty containers, collect these plastic paper bags. Let us discard them. Yes. Let us close our windows early enough. And let us, strictly put your nets very well in the bed, not just covering your head. Yes.
All right. Maybe as we come to conclusion, every effort, every work requires money. And we realize one of the organization has cut the budget that supplements for malaria efforts to fight against it. What do you think this means to the efforts that as a country we are putting, because now the budget has been cut off and we require this money, and maybe they are donors, right? But now we'll be struggling. How do you think this affects verily the efforts that we're putting to fight against malaria?
Let me just quote the president of Rwanda, that Africans, we like receiving. We don't like working hard. In fact, we need to now strategize. We need to improve on achieving universal health coverage, because under universal health coverage, we are telling the government that there's health financing. Improve on the health financing. Improve of the amount that you're giving the health sector. Improve of the amount that you're giving the health workforce, so that they improve They're even motivated on creating awareness on malaria. So we are telling the government that increase the amount you are giving the health sector, so that we increase also the people we are reaching in this Kenya.
Yeah. I have seen campaigns of other conditions, like right now as we speak, the polio campaign has already begun, and even as you were marking the Malaria Day, I never saw such. So I'm wondering, when is it coming? Because this thing is serious.
Malaria has been with us, and it is still with us. There is so much campaign by the we have like a teacher-pupil syllabus developed for malaria. We've empowered our community health volunteers in the communities to detect malaria. So I think so much has been done for malaria that we want to focus somewhere else, maybe to, you know, polio, to focus for hypertension, these upcoming drugs, these upcoming diseases. Yes. So much is happening for malaria. Yes. There's malaria distribution. There's, you know, creating awareness. It's so much.
True.
Yeah.
Now, maybe now as we finish, to answer to our question, is Kenya winning the battle against malaria? What have we achieved so far? The mortality rate, where are we as in numbers? Speaking of the regions, the endemic regions, comparing this year, last year and the previous year, because now 2016 was the worst globally. So where are we currently?
I cannot say we have reached there yet. No, we have a long way to go. We need to do a lot. We need to strategize, yeah? And it's part of achieving universal health coverage. When you talk about malaria initiatives, we need to think outside the box. We need to customize. In each county, we have, if NETS is not working in Busia, or NETS is not working in Coast, what can we do? Yeah, we need to, you know, come up with a different solution in different counties and actually embrace the community to give a solution. Because you can go and give nets, distribute nets to Busia. True. And they say, you know what, we are keeping these nets because Daktari gave us. They didn't explain. So we need to customize, involve the community in any initiative we do, so that it becomes a success. But we've come from far. Yeah, that is what I can say.
And some of us complain that when you sleep under the net, there's too much heat. So
I know so many complaints, so many complaints. Some say it reduces libido, you know. So we are telling them, no, nets are here to protect you. Right. Yes.
Now, apart from nets and the vaccine that you are waiting for, what other prevention measures do we have?
So in Kenya, we have net is suitable because it is cheap. Once you buy, you can stay for four years without even thinking of buying any other preventive measure. Yeah. Apart from nets, we have repellents. Yeah, there's those we apply. There's those that I can see nowadays. We have like a mosquito repellent. You put it in the electricity so that it produces rays, which is costly. True. Yeah, and then we have the basics, clearing your bushes. Yeah, discarding containers and plastic bags correctly. Yeah, and then we're having covering yourself. If you live near a water source, you close the windows earlier before the mosquito come in. Yes, so we have a lot of interventions, and also creating awareness. We are even encouraging teachers to pupils to go, you know, the pupils, a kid can tell you so much. Yes. So we are telling teachers to key messages to pupils so that pupils can go and spread the word to their communities. Yes, and not forgetting community health volunteers who are our key person in the ground. Well,
we appreciate them. And as for you, thank you so much for making it to Y254 and shedding some light on where we are as a nation in fight against malaria. And back home, thank you so much for keeping it Y254. I hope you have learned something, and keep on talking to us through our SMS line 22162, beginning with the word Y News. Again, 22162 is the SMS line to use. You can also choose to tweet. Our Twitter handle is at Y254 channel, hashtag being Y254 updates. My name is Dereva Hillary. Have yourself a good night.